Hello, everybody, and welcome. Thanks for joining us. My name is Sarah Hashimwaris. Recently, the Los Angeles Times published an investigation into how prescription drug overdoses are now claiming more lives than heroin and cocaine combined. Reporters Lisa Guerillon and Scott Glover took a deeper look into coroners' records and found that in California, drugs prescribed by a small number of doctors caused or contributed to a high number of deaths. Lisa and Scott, thanks for joining me. So let's start off with, how did you guys get involved in this series into looking into prescription drug overdoses and deaths?
Our work started a couple of years ago, really. I was covering federal courts at the time and wrote about the cases of some doctors who were prosecuted for prescribing drugs without a medical cause. They were actually federal court cases, so they were charged under a drug dealing statute. And that got me interested in the topic, and when I started to poke around a little bit, I found that there was a lot to learn about prescription drug use and misuse and abuse, and more work than for one person. So I asked Lisa, who had a background in covering healthcare, if she would like to get involved. And like I said, I mean, we've written a great many stories over the past couple of years, but we've been working on it for all that time.
And were there any particular court cases that really stuck out that kind of led themselves to all of your research?
There were a couple of prosecutions that come to mind. One was a doctor by the name of Masood Bamdad. He's serving a prison sentence now, and he was prosecuted several years ago for prescribing to younger patients, in their 20s and so on, who the argument was that they didn't actually need the drugs, that they were there under a guise to get narcotics to which they were addicted. There was another doctor by the name of Healy, who was out in the Duarte area, as I recall. Same kind of circumstance. The allegations were that the patients weren't there for a true medical need, but they were there to get drugs that they wanted because they were addicted to them.
And we'll talk a bit about some of the doctors that you guys interviewed for this series in a bit, but I'd like to start off with, you guys looked at 4 different counties within Southern California, went to the coroners, sort of, rifled through the reports. Can you talk me through the process?
Sure. We started out, we wanted to take a look at, see if we could figure out what the scope of the problem was in Southern California, the entire area. So we put in Public Records Act requests with 7 Southern California counties, from San Diego to Santa Barbara. Ultimately, 4 counties, 4 of the larger counties, Los Angeles, Ventura, Orange, and San Diego, were able to give us records and data that were complete enough that we could get a good picture of what was going on. Ultimately, we created a database out of thousands and thousands of drug deaths, and learned that there were more than 3,700 prescription-involved drug deaths in the area over the 6-year period that we were investigating.
And we used other documents associated with those cases that would list the prescriber of medications that were prescribed to the deceased, often found at the scene. And we're able to make a linkage in that regard, where a doctor had prescribed a drug, the drug was present in the person's system and either contributed or caused the death.
So then there were about 4 doctors that you guys talked to. How did you sort of end up with them? And can you tell me about the process of sort of talking to each of them and what their struggle was like as a pain doctor, knowing that they're kind of doling out these medications and there's some patients who are, overdosing and dying?
Sure. I mean, the doctors that we identified in the investigation were primarily pain doctors, family doctors, or psychiatrists. And we interviewed several, and some were featured in the story. And these were folks who had an inordinate number of patients died compared to the others that we were looking at. 16, I think, was the number in one case. And the doctors had very similar things to say. They're dealing with a very difficult patient population, where you may have someone who's struggling not just with chronic pain, they've had for many years, and might be the result of botched surgeries or this sort of thing, but after having taken these potent drugs for some period of time, they may be physically dependent. It may be to the point of addiction. So they are very difficult patients to deal with. These doctors, uniformly talk about taking their obligation very seriously, having them sign pain contracts, checking a state prescription database to see whether they are, shopping around with other physicians to try and get the drugs, conducting urine screens, and, using all of these precautions that they'd be expected to use. But still, you have, without, lying any blame or whatever, there are patients who are dying, and this is, a big problem in the country right now.
And then with some of the drugs, there's a couple of interactive graphs and charts that accompanied your story on latimes.com. What are some of the top, deadly prescribed drugs that are associated in these accidental overdose deaths?
Well, it's very interesting because these are drugs that are very commonly prescribed now. But 15, 20 years ago, you would really only have access to them if you were a cancer patient or somebody with a terminal illness, oftentimes in hospice or hospital. There was a major change in the country and in sort of the way of looking at pain, and there were strong arguments that it was inhumane to allow people with chronic non-cancer pain, to suffer. And so these drugs became more widely used. And now the drug that we found most often in the 3,700 drug-involved deaths that we looked at is a drug called hydrocodone. It's sold and commonly known as Vicodin and Norco. A lot of people who've had a tooth pulled, have probably gotten a prescription for that. So those are the kinds of drugs. Another one is OxyContin, which is often prescribed for pain relief. And these are now some of the most popular drugs and most widely prescribed drugs in America. In fact, according to the CDC, there's 300 million prescriptions for these kinds of pain relievers written every year. And that's enough for every adult American to be medicated around the clock for a month. So they're really out there and in wide usage.
Broadly speaking, you're talking about painkillers, anti-anxiety medications such as alprazolam, sold under the name Xanax, muscle relaxants. These are the type of drugs that you often see. Methadone, which people are usually, you hear about that in the setting of someone who's trying to come off heroin, and it's given out in doses in a clinic, but it can also be used to treat pain. Those are the types of drugs that we most often saw.
So what did you guys find out about the demographics that are using these painkillers?
That's a really interesting question. For one, coming into the story, before we had done a lot of investigating, we were aware that the government was really trying to address this and seeing the problem coming up as teenagers, stealing drugs from their parents' medicine cabinet and having pill parties and those kinds of things. And you hear a lot about abuse involving, younger people. What we ended up finding through our investigation was that the average age of people dying on these kinds of drugs is actually 47, and most of the people are in their 40s and 50s, although we did have some of the decedents were as old as in their early 70s. Most of them, or many of them, were introduced to these drugs through pain treatment. They had legitimate workplace injuries or a lot of car accidents, a lot of chronic back pain just from issues that attendant to age. And so they had gone to a doctor and maybe many years ago or even recently and started using these drugs.
We identified 298 people who died after being prescribed drugs by these 71 doctors that we identified who had 3 or more patients who died after they were prescribed drugs. And when you look at that population, the 298, it's stunning to see what they would call red flags in terms of history of substance abuse, past overdoses, past stints in rehab, depression, anxiety, these types of things. Now, this is not to say that these things were necessarily known to the physician, because there seems to be quite a disconnect between what is in the charts of the patients based on their interviews with a doctor and what family members will say when interviewed by coroners investigators. It seems that we've had doctors tell us people are not forthcoming about these things because they're trying to get drugs, but that's something that we really noticed, that the histories were perhaps not reliable. But if a doctor were omniscient and knew all these things, you could almost see something like this coming.
Sure, and in terms of the histories, I wanted to see, are there any stats that you guys kind of found in terms of the numbers of, 50% had previous substance abuse or anything like that?
It's even beyond that. As we sit here, I'm not sure exactly what the stat is, but it's above 80% who had at least one red flag that they might be predisposed to having a problem with the drug.
So then you mentioned urine tests with the doctors. Is there any other sort of regulation in place that these pain doctors kind of follow in order to make sure that once they prescribe a really high level painkiller to a patient, that once they walk out the door, what can they do?
Well, there aren't a lot of regulations. The urine tests are part of a number of guidelines, recommendations that organized pain professional groups have recommended. So they include things like urine tests, and what the doctors are looking for there is to see that the patient is actually using the drug that the doctor prescribed, because these drugs have a high street value, and so the concern is that a doctor might be contributing to street sales if their patient isn't taking them as prescribed and is in fact selling them. The other thing they're looking for in the urine test is to see that they're not using illegal substances or even alcohol, which could interact and cause problems. Along with the urine test, other forms, kind of safety guidelines that doctors can use, as Scott mentioned, one is they can check a state-run pharmacy records database that will tell them if their patient is getting drugs from anybody else. Some of the other things they can do is they can talk to family members and find out what's going on there, although a lot of the doctors that we spoke to felt like they hadn't heard from family members, that there were problems going on with the patient. So I think they're thinking about having, more open communications there.
Sure, and then I want to touch upon the family aspect a bit later with one of the, video packages that you guys did, Another Day Without Alex. So we'll touch upon that in a bit. But with the doctors that you talked to, what did you find in terms of how they actually got into this field and sort of stayed in this field?
All of them talked about having compassion for people with pain. One talked about actually watching his grandfather, be in terrible pain in another country where he was growing up and being denied morphine because of the fear of addiction. And he said that was something that was, inspirational to him in terms of wanting to treat people in pain later in life. Some were trained as anesthesiologists, but they felt they had more contact with patients when they were dealing in the pain setting. So obviously, the way that they're putting it is a real desire to help people.
So was there any sort of acceptance of blame with the doctors that you talked to, linked to the fact that some of the prescriptions that they're writing to these patients, a good number of them ended up accidentally overdosing? Did they sort of accept that blame, or was it just sort of, well, I did what I did, I told them that there's a high risk of fatality, and then they walk out the door? And
I wouldn't call it an acceptance of blame. Clearly, no doctor is happy to hear that a patient has died. But I think the doctors that we talked to were, adamant that they had taken all of the precautions that they could. We just talked about what some of those things are: conducting the urine tests and checking the state database and doing these types of things. And there was definitely an echoing of, yes, there is a little fear when somebody walks out the door with a drug that is a close chemical cousin to heroin. You know what I mean? And when you have someone who is dependent on the drug or perhaps even addicted, obviously there can be some uncertainty as to how they're going to use it. And one thing that we heard consistently is, I can't be there looking over their shoulder when they take these drugs.
so
The doctors also expressed some things that they wished would change or that could help make prescribing these kinds of drugs safer. And they expressed concern that insurance companies and Medicare and Medi-Cal had cut back on the amount that they pay, making it more difficult to see some of these complicated patients as often as they would like to keep a close eye on them. Also, difficulty in obtaining payment and authorization for diagnostic tests and other services such as physical therapy, addiction counseling, psychiatric counseling, that they believe might have put these patients in a safer place. So they do see that there are some problems that maybe could improve.
And a lot of these problems can go hand in hand with chronic pain. You know, if you are in true pain and it lasts for any length of time, you can become depressed. You know, you can have other problems that are related to it that the doctor has to deal with, you know, simultaneously.
And now you guys noted in your story, the CDC is sort of pushing for law enforcement agencies to, you know, go to the coroners and go to, you know, get information from pharmacies about these prescription drug overdoses in terms of prevention. Can you talk a bit about that?
What the CDC was recommending is that that state medical boards access these prescription drug databases that we talked about and use them to look for what they call doctor shoppers, a patient who is going from one physician to the next, trying to dupe them into prescribing duplicate drugs, basically going to these doctors and trying to get drugs for the wrong reasons. But they were also talking about using it to identify doctors who cater to an inordinate number of doctor shoppers, you know, to spot a pattern there. Do you have these types of patients gravitating to certain doctors? And, you know, what does that tell you? So they're trying to, you know, get people to use it as an investigative tool.
So have there been any crackdowns?
In California, they're not using it in either fashion currently.
This is really an evolving problem. As I said earlier, these drugs weren't widely used 15 or 20 years ago. And now that they are in widespread use, it's been kind of a gradual recognition that there are a lot of consequences, including, you know, emergency room visits and deaths. And so what now you see are authorities, both on the public health, medical boards, and law enforcement, all grappling with, you know, how to get their hands around this problem and ultimately reduce death. Up until now, the focus has been on the black market, on pharmacy robberies, on teenage pill parties, and that kind of thing. And so what our story showed was that there is also a big aspect to this problem that's related to people going to see doctors for pain and, you know, overdosing on the prescriptions that they get from doctors.
And that's not to say that there haven't been prosecutions of doctors. You know, as I said at the beginning, that's how I first became interested in this. The DEA and, you know, the LA County Sheriff's Department, narcotics guys, they have prosecuted a handful of doctors here in Southern California over the past few years. But they are very difficult prosecutions. I mean, doctors prescribe drugs. You know, if they, let's assume that a doctor is up to no good, but if they cover the bases and they ask, you know, a patient, do you have pain? And the patient expresses that they have pain and they kind of go through the steps, it's a tough case to prosecute. You know, you send in an undercover to try and get OxyContin from a doctor, and if that undercover goes in there looking all scruffy and everything, but talks about having back pain, that's a problem for the prosecution because, you know, they're going in there saying they have pain. So, you know, prosecutors want really obvious cases to try and prosecute someone for, you know, what could be argued, you know, is doing their job.
So moving on from patients to doctors now to the families, as I mentioned earlier, there was a really great, video interview with two parents who lost their son, Alex, in 2008 from a prescription drug overdose. I'm interested in finding out how you sort of met these parents, Ron and Arlene Clyburn, and kind of what their story was. Just if you could walk me through that.
Yes, I met them several years ago. They lost their son Alex. He was, I believe, 23 when he overdosed. And I went out to their home in Ventura County and interviewed them. And as you know, for folks who haven't seen the video, I would recommend they take a look. It's you know, very emotional, very compelling. They you know, are a very tight-knit family. They were involved in sports and their community, and you know, just seemingly very loving parents and with good kids. And Alex got into a car accident, and he was treated with painkillers, and you know, developed a problem with those drugs, and ended up dying from them. And at one point, he had been prescribed those drugs by a doctor. And it's just the focus of the piece is really about their loss. And, it's just, it's something that, since we began reporting a couple of years ago, we have sat around many kitchen tables or in people's living rooms and heard the same story, again and again. And it's, I suppose, a cliche to say that it cuts across, different swaths of our society, but I mean, it does. It doesn't matter how rich you are, how poor you are, male, female, whatever. We've seen it in so many different circumstances, and it's just with the addiction aspect of it. There's the death, but then there are all these months or years where you're dealing with an addict, and it's very, very tough situation.
Yeah, definitely. I want to touch upon some of the readers' comments because, your main story really garnered a lot of attention from all sides. So I'll just go ahead and read a couple of them, and then I want to get your reaction as the people behind the scenes who worked on this story. So the first reader comment comes in from someone with the username Christopher Keller. The Times does not put the blame here where it belongs, on the patients. Almost any pain-killing drug will also kill a human if there is a large enough overdose. I mean, what do you guys have to say after interviewing people, the family of Alex, his parents, where there's certain people out there who are saying, well, it's just the patient's fault?
Yeah, I mean, we've heard from a number of people like that, and I can certainly see their point of view. But if you're a physician, you're going to hear from experts in your own world. It is your duty to carefully screen your patients, and it is your duty to monitor them while they're on these drugs, particularly if you have concerns about them being vulnerable. If they're showing signs of abuse or addiction, you need to, watch them very closely so that it doesn't get out of control. And we're not looking to cast blame one way or the other. We're trying to illuminate a problem here in society. And I guess, it's come up in conversations we've had with doctors where they'll talk about them signing pain contracts and doing this and that. And one question I have is, well, when you're dealing with somebody who's physically dependent on an opiate or perhaps even addicted, don't you have concerns that they're going to sign anything to get those drugs? And people have, quietly conceded, yeah, that is a concern. So I think it's somewhat naive to just say, well, they're addicts and it's their fault and so on. I mean, addiction is a disease, and people are somewhat predictable and being unpredictable.
Sure, and go ahead.
The other thing is a lot of the people whose lives we explored and who ultimately died on these drugs had real pain. They were really trying to get relief from real pain. Some of them, in one case, it was a woman who had young children at home and was trying to be very careful with these medications so that she could remain alert and take care of her kids, and died, and she had a trip planned in the near future. So she was clearly not thinking she was going to die. It was absolutely accidental. Another gentleman was a police detective who had hurt himself, in the line of duty, and had become dependent on the medications, but still needed them for pain. And he died with, whitening trays in his mouth. So he clearly, didn't think he was going to die when he took his last dose. So you see that over and over again, where people had full lives and families and people who cared for them, and they were cut short very suddenly.
I think for some people, the word addict conjures a vision of, somebody in the gutter or with a needle sticking out of their arm. And, I can tell you there are a great many people we came across while reporting on this story who, if you ran into them in everyday life, at least at one point in their lives, would have come across as very normal to you.
Sure, and I think we're just about out of time, so I really want to thank you, Lisa and Scott. And for you viewers at home, thank you for checking out our broadcast, and also be sure to check out Lisa and Scott's coverage on the LAtimes.com. There's a lot of fun, interactive, data and information. So thank you.